Brandon, with the unexpected impact of the pandemic, there has been an unfortunate increase in the number of children struggling with mental health. Back in January, the Newsom administration said they'd invest $4.4 billion into the systems that support behavioral health for children and youth. We're now taking a look at that money and how it's going to impact Kern County. So 23 ABC's Brianna Polk joins us in the Live Center to share more about the funding and how local organizations have continued to provide behavioral health services during the pandemic. Brianna?
That's right, Kristen. Well, poor mental health in kids is more than just feeling blue. It can heavily impact many different areas of a child's life. The CDC stated that youth with poor mental health may struggle with school, grades, and decision making. With this funding, they hope that things will change for the better. And a study from the CDC found that the treatment rates among children ages 3 to 17 varied. As you can see here, 78.1% of children were treated for depression, 59.3% of children were treated for anxiety, and lastly, 53.5% of children were treated for behavior disorder as well.
The impacts of the pandemic on our children are becoming more evident and more visible. We are seeing kids suffering more significantly than they were before.
Stacy Kuwahara, Behavioral Health Director for Kern Behavioral Health and Recovery Services, says that the money that is being spent to assist the mental health of kids increases the accessibility of services at a place where kids are already going and are already comfortable.
Money is going into places like into the schools, into other providers who are providing services at a lower level of care, which is great. Resources, education, initiatives need to be embedded throughout our community and all of the places where our children interact and touch.
There is no set date on when this investment actually hits organizations and schools. Kuwahara says that the pandemic really caused their Children's Services Department to shift in new ways than ever before. She says they have had to use a lot of virtual sessions, which wasn't the easiest transition for younger children, so they were eager to find another solution.
We had to continue office-based services because virtual services work really well for some kids, especially teenagers are very comfortable with virtual services, but a lot of young kids really don't adapt well to that and needed to be seen in person. So we've had to just be very flexible in how we work during the pandemic.
Kuwahara expresses that they were fortunate enough to have remained as a reliable resource throughout the stages of the pandemic. She says that the practices these kids are developing now will carry on into their futures.
When you learn how to take care of your mental health as a young person, you're learning skills that are going to stay with you for the rest of your life.
And if you're a parent or guardian who has questions on how to assist your child who's suffering from mental health, you can access the 24-hour crisis hotline available here on your screen. But for more information, visit our website at turnto23.com. In studio, Brianna Polk, 23 ABC News, connecting you.